Hospitals across the United States are stressed with a record number of COVID-19 patients. The Omicron variant now accounts for 98% of all new cases. Hello, I'm Mike Walter filling in for Anna Naidu, and this is The Heat. Cases of the Omicron variant are exploding across the United States, with more than 145,000 people hospitalized. Overall, infections are also at record levels, with the U.S. averaging more than 700,000 new cases a day. Health officials warn the coming weeks will be the most challenging of the entire pandemic. Even more startling, the country's top infectious disease expert, Dr. Anthony Fauci, says everyone could get sick.
Virtually everybody is going to wind up getting exposed and likely get infected. But if you're vaccinated and if you're boosted, the chances of you getting sick are very, very low.
For more on the surge of the Omicron in the United States, let's bring in our panel. Joining us from Connecticut is Dr. William Haseltine. He's the chair and president of Access Health International and author of Variants, the Shape-Shifting Challenge of COVID-19 Vaccine Evasion, Reinfection. With us from New York, Dr. Calvin Sun is an attending physician and clinical assistant professor in emergency medicine. And here in Washington, D.C., Joseph Williams is the senior managing editor of The Color of Change. Calvin, why don't I start with you? The numbers we just said from the New York Times, we're looking at about 700,000 cases a day. Just remarkable. And a lot of these folks are ending up in the hospital. You're right there on the front lines. Describe for us, take us inside one of these wings with you. What's a day look like?
So right now where we are is a plateau in New York City. If New York City can be a lighthouse, 2 weeks ago, we said it was going to be like this for the rest of the country. We're like a wave that hits us first, and now it's spreading across the country, and that's what you're seeing right now. And where we are is now the plateau, where that's not great, because you can't drink out of a fire hose, and the fire hose somehow plateaus. I'm still going to drown in that fire hose, and I don't care if it's getting better, if you will. Relative, it's a low bar to overcome. So when I start a shift now, we're exhausted, and we're also looking around, like, who are these new people? In fact, where did that other person that was scheduled to work go? Well, they got Omicron, they got sick. And that's why we're seeing also the guidelines is changing, during mid-shift, where it was, you get sick, you have to stay out for 10 days because you don't want to give it to patients. Technically, it's 18 to 20 days is the median time for contagiousness. But now they're making 5 days. And in mid-shift, now we're hearing from other parts of the world, in the developed world, that even if you're sick with Omicron, get back to work and put on 995, because the alternative is to shut down the healthcare facility, because we are severely understaffed. And we're basically bringing in all these new staff members who are getting a crash course in emergency medicine to fill up these spots. So it's really difficult to really manage this plateau, if you will. We have vaccines now. That's great. But it's kind of like old age. Like early on in the pandemic 2 years ago, we were fresh-faced. We were ready to fight this. Now we have vaccines, but we're also tired, right? It's old age. You were younger, you were fresh-faced and everything, but you had all this energy, but you weren't as knowledgeable. Now you're wiser, you're older, but you're also burnt out. So we're mortally injured. That's my shift. That's how my first 5 minutes goes.
And you said some of these folks getting sick, and that's worth exploring a little bit, because I know of a nurse in L.A. who works in one of the COVID wings. What people don't think about is the protection that you all go through. I mean, you're not going in with a cloth mask. I mean, the steps that you take, and yet you're still getting it, that says a lot about just how contagious this is.
It's extremely contagious. I mean, I'm hearing patients that they're treating this like the smallpox, where they have not smallpox, chickenpox. Smallpox was fixed by vaccines. Chickenpox, we still have that. And even, if you're not vaccinated chickenpox, remember the chickenpox parties where there's like, I want to get Omicron just to get this over with, and exposing themselves unnecessarily, not realizing that portends them at a risk for increased hospitalizations, or they get into a car accident and they go to the hospital, and because of this chickenpox party approach to Omicron, they happen to test positive in the hospital, and therefore they have to be cohorted to an Omicron area or COVID area, and they have to wait hours and hours and hours for a bed, especially if it's filled with unvaccinated people, and that's exposing all of us. So it's this, I think, this morally injured that's leading to this burnout, this what you call PTSD, where people want to get injured now just to get it over with rather than avoiding it entirely. And it's understandable, that sentiment.
Joseph, let me ask you about the political dimension of this because the Biden administration is taking their hits as well. It seems as though there's some mixed messaging going on. I know you can't see it, but I'm holding up one of these at-home kits. This is almost like having a Bitcoin or gold. People can't get their hands on these. You go into any of these pharmacies, and the first thing you see is a sign, "We're all out." The administration now saying they're going to send 500 million home tests to Americans, but is this kind of a late gesture in a way? All right, we're having trouble with Joseph's sound. We'll try and get to him in just a minute or two. Bill, let me ask you about the health officials. They're talking about the Omicron variant and just how easy it is to catch it. The FDA acting commissioner, Janet Woodcock, spoke to a Senate panel the other day. Let's listen to what she had to say.
I think it's hard to process what's actually happening right now, which is most people are going to get COVID. All right, and what we need to do is make sure the hospitals can still function, transportation, other essential services are not disrupted while this happens.
Bill, talk to me about this. I mean, it's really kind of jarring when you hear her say that and then you hear Fauci saying, look, chances are you're going to get this.
Well, it's the reality. This is a highly contagious virus. We in the United States are doing virtually nothing effective to control it, and that's been a fault in the United States, and I should say through all of Western Europe and most other countries in the world, as a matter of fact. And so most people are going to get it, vaccinated or not, but there will be a big difference. If you are vaccinated, this is a rather mild infection for most people, not for all, but for most people. If you're older, over 70, or if you're a young child and not vaccinated, this is a very serious infection. But if you're not vaccinated, this can kill you. Not only can it kill you, it can give you long COVID at a very high rate, and that may permanently damage your lungs, your kidneys, your heart, your pancreas, and your brain. We're now realizing that long COVID is really serious, and this virus can give you that. So the idea that you should go out and get this is close to insanity. The other thing we know is that having been infected is no guarantee you won't get infected again. Many, many people who've been infected and fully vaccinated, or just infected or fully vaccinated, are getting this. And I was able to predict that a year and a half ago, that this virus, there would be no such thing as herd immunity for these viruses, just like there's no herd immunity for influenza. So this is a really dangerous virus, highly contagious, and not something you want to get. And if you do get it, you surely should hope that you've been vaccinated.
And Bill, does this get us any closer from segueing from pandemic to endemic, though? Some people are talking about making a suggestion of that. Any evidence that that might be the case?
Well, let me say there's a fault in that thinking, that endemic is good. Tuberculosis is endemic. Hepatitis C is endemic. You don't want to get those. Just because it's endemic doesn't mean it won't kill you. It just means it's always there. So going toward endemic is not good. It means there's a killer in your midst permanently. So that isn't what we want. What we want is a way to really control it and drive the infection rate very low. That can be done. It has been done in other countries, a few other countries. And it's a shame we haven't done it, but endemic is not a good endpoint.
Well, let me ask one more follow-up with you about that. Really control it, you said. I remember back, and I'm sure you remember this too, let's flatten the curve. And the suggestion was if we flatten the curve, that gives us time to get strategies in place so we can combat it. But it didn't seem like those strategies, tracing and testing, that they really didn't fall into place. What needs to happen? I mean, what steps should be taken?
Well, there's a lot of things we should do. The first thing is this will pass, Omicron will pass, and the incidence will go way down. Then we have a chance. Then we have to take the lessons from those who have controlled the pandemic best, and that is to identify, contact trace, find out who has been exposed, and treat those exposed as if they could be infectious, and then make it economically possible for them to isolate for the infectious period of time, which is not 5 days. It's more like 10 to 15 days. while people are still infectious. So that's what we can do. That's what we know works, regardless of vaccine efficacy. The next thing we can do is make sure everybody is vaccinated. Now, when we talk about testing, back in March of 2020, I proposed that we would need on hand about 3 billion tests so that people could really test themselves 2 or 3 times a day, and that they should be free. A couple of countries have actually produced that number of tests that we could use. We don't do it. So there's many things we can do. We haven't done them yet, and it's time for us to get real. That if we're going to look at this as an endemic, deadly disease that's always with us, we better make sure it's as low as we can make it.
Joseph, we've ironed out the audio difficulties. Speaking of a billion, I've got 1 in a billion. I have this test in front of me. They're very hard to come by, as I mentioned earlier. Biden administration saying about 500 million home tests will be sent out to Americans. Is it a little too late?
You better sell that sucker or hold on to it for the next couple of weeks. It'll be quite valuable. The Biden administration has said that it's going to send out tests to every person in the United States, 500 million tests, I believe. Almost too little too late, because there have been so many twists and turns, so many hairpin maneuvers of this virus, and it's been so slippery and evasive that it's been difficult for them to stay consistent on messaging. And that's one thing that's got a lot of Americans throwing up their hands. Are there testing mandates? Should there be testing mandates? Should there be mask mandates? We have 50 states and 50 different strategies. And now that the horse is out of the barn and down the street and chewing on your neighbor's apples, it's a little bit past time to say that 500 million tests are going to be anywhere close to enough, especially when you have teachers begging for tests in their class and other places just searching for workers who haven't been affected and who are willing to go into the breach and work for money to possibly risk infection.
You have Dr. Haseltine saying it should be 3 billion tests. I want to bring into our conversation Dr. Allison Messina. She's the chief of the Division of Infectious Diseases at Johns Hopkins All Children's Hospital in St. Petersburg, Florida. I know that you're seeing a lot of cases there in Florida. How does this differ? Calvin talked about the beginning of the pandemic there in New York, what he's seeing now. Would you give us a scene setter, what it's like there for you, especially since you're dealing with kids, and we're seeing a lot more kids getting this as well?
Yes, we experienced a big surge of Delta in the late summer. And we had a few months where our rates were really low, but now we're back into that surge again, where we're seeing cases similar to what we saw with the last peak, where typically in my hospital, which has about 250 beds, we're typically running between about 15 and 20 patients in the hospital with COVID, which is similar to what we saw with the Delta peak in the late summer. The only difference is that we're seeing less patients proportionally in the ICU. So if there's one silver lining, I think that's it.
There also is this out from the U.S. Center for Disease Control and Prevention that 1 in 6 children ages 5 to 11 are fully vaccinated. So out of the kids that you're dealing with, how many of them are vaccinated? How many are unvaccinated? And what kind of difference does that make in terms of what they're dealing with this?
Yeah, so by and large, we see most of the kids that are more seriously ill are unvaccinated. And that's something that we saw with the last surge with Delta, and it's something that we continue to see now, especially the children in the younger age group, the last group so far to have been vaccinated, the 5 to 11s. We really see very few of those kids vaccinated, which is unfortunate.
Calvin, you touched on this a little bit, and I'd like to maybe probe a little bit deeper with you on this issue. I kind of liken it to a boxing match. You know that you're going to go 15 rounds. You're going to take your hits. Hopefully, you'll get out of it standing. In this case, it's almost like you do 15 rounds, and then it's like, well, you take a 5-minute break, then you got to do another 15 and another 15. And as you were saying, the fatigue factor wears in, the PTSD, all of that. What are your colleagues saying to you? And I mean, you mentioned that some are leaving the profession. I mean, we talk about this great resignation here in the U.S. Obviously, some healthcare workers falling into that category. What's it like?
There's Excel spreadsheets. I have like a Google sheet, a library of Google Sheets called The Great Resignation. Everyone thinks they're so unique. Every hospital probably has one. You don't know unless you've been invited. But I think everyone's been invited at this point where they're putting in their skill sets. I think there's a good article on NPR where all these healthcare workers are engaging creative processes they never thought about doing before, and it kind of leads like a bridge into something else they would probably do after this is all over. Burnout is real. More injury is real. I mean, I am lucky to be per diem or work on a per diem schedule. Ever since residency training, I've always done that so I could control my schedule. So I just took a week off. I had to, because I worked throughout the holidays, 9 days straight, 10 shifts over 8-9 days, because people were just dropping out and it's covering all those holes. And, you know, exhausting. Just, you know, it's great that we're all vaccinated, but I said before, we're just, you know, it's 2 years in without relief. And as you said, the boxing match, like, it's getting punched in the face because Omicron doesn't care, and they're actually breaking all the rules. So I think it depends on who you're talking to as well. A lot of colleagues haven't. When you're talking to me representing a profession of colleagues who put patients above themselves, it's a habit. So it's very hard for us to fill our own cups and take care of ourselves before we take care of others. So it's just it also depends if they're even aware they're burning out. This compassion fatigue, and you get to see in patient interactions until they get sick with COVID, and then they take the 5 to 10 days off, or now in this case they go back to work tomorrow, and then they realize that this is not exactly what they signed for.
And you said a wave. This is more like a tsunami. I've got to have the feeling that some of these people, as you said, the burnout, you can see the compassion fatigue, all of that. How is it impacting the quality of care?
You definitely are moving back towards where we were 2 years ago in March 2020, when we were running out of ventilators, hospital beds, and this is the time before a vaccine where everyone was getting sick or exposing themselves in the healthcare facilities for tests that don't even exist, coming in line around the block, whether, you know, it was for a cough or for a test. And that way you have to engage from what we prefer in a developed world is doing everything for everyone. But we had to move towards a model of doing as much as you can for as many number of people as possible. That means you have to cut corners. And when we are now cutting corners in terms of bringing healthcare workers back, even if they've been infected with Omicron, and cutting that from what we know, 18 to 20 days is the median range from which you can be contagious for COVID, from 18 to 10, 10 to 5, 5 to tomorrow. And it's like, where, you know, patients are just, they're still coming, and then, you know, healthcare workers can't keep up, and especially with the conversations we have with them, it doesn't give us any room to recharge. So, you know, it's been unforgiving.
Allison, Calvin said that he could see the wave coming. He knew when the wave was hitting. He sees it cresting now. I've got to ask you about Florida, because it's a major hotspot right now. In just one day last Friday, the state set a daily record with more than 76,000 cases. So where are you in this progression? Are you at the wave stage? Do you feel like it's cresting? Do you feel like you're getting inundated? What's it like?
Yeah, I think we're really kind of at what we think may be the peak, but it's really hard to tell. But we're really, you know, at capacity right now in terms of our patients and our staff that are getting sick. So it's not only that we have a lot of patients coming in, but we find that we're having fewer and fewer people available to care for them because our staff is out. So we've had to employ, similar to other places in the country, we've had to employ very creative solutions to try to keep the hospital staffed and keep those patients that are there well cared for. And that's getting challenging. So we're seeing a lot of cases right now. There may be some early indicators that we might be peaking. I certainly hope we are, because I would be thrilled to see those cases start to come down very soon.
Allison, one other follow-up on this. Are you still seeing the pushback? I mean, there's so many people who are anti-vaxxers, and then you hear the stories, they get into the hospital and they're like, please give me the vaccine now. Are you seeing parents who don't want to give the vaccine to their kids, and all of a sudden this sudden realization, now they're in the hospital, maybe I should have, you know, buyer's regret, that sort of thing?
Yeah, we do get a few questions sometimes when patients are admitted with COVID, where families ask if they can get the vaccine now. But of course, once you're sick, it's a little bit too late for that. But we are encouraging families who have patients that are sick to, when they recover, to get them vaccinated. And sometimes, you know, I think sometimes that's the realization that people need to come to to decide that vaccination is a good thing. I think that in the pediatric population in particular, it's harder, I think, to overcome some of the anti-vaccine sentiment because people are scared enough to get, if people are scared enough to get their own vaccines, they're certainly going to be very scared to get their children vaccinated. So we try to do everything we can to try to alleviate, to understand those fears, to try to talk to them rationally and try to alleviate some of those fears, because we do think it is the safest thing moving forward is for people that are eligible to be vaccinated to get their vaccines. It's very important.
Joseph, on the subject of kids, they've been in the news quite a bit lately because of the struggles in Chicago. Teachers didn't want to reopen. They wanted to do things virtually. The mayor, as you know, said, no, we got to get the kids back in the classroom. There's been a big push for that. The Biden administration now promising millions of free COVID tests to help the schools stay open. Is that going to work? And how much of a concern is the school setting now moving forward?
The school setting is a big concern, although it's low, relatively low risk as opposed to, say, a crowded nightclub. Schools are relatively lower risk than other places in society, yet you still have some teachers who are concerned about kids passing it from their parents to them, some parents concerned about kids bringing it home from school, and everybody's really concerned that not enough is being done. The Biden administration is promising more tests for teachers, more tests for schools, but those are still late in coming for some. There's a COVID wave going on where I live here in Washington, D.C., where school has gone virtual for a couple of days, simply because there's an outbreak of infection, but also because there are sick teachers, and there are teachers who are caring for sick children or sick adults and sick relatives. Now, layered on top of that, you've got a shortage of drivers, bus drivers because of the COVID vaccine or because of the COVID virus, drivers who are either sick or they don't want to risk getting COVID from kids. And the whole situation is quite a muddle. So while the testing and the protocols will help some, you are going to have more situations where schools are going to shut down for a week, maybe two, a couple of days at the very least. You are going to have a series of teachers who are rebelling against the district for forcing them or trying to force them to get back into the classroom. And the whole thing for parents has them kind of throwing up their hands, particularly when they're trying to get their own work done from home, and they've got to make sure that Johnny or Janie goes to class on time. So until we get either a solid national plan, either everybody gets on the same page about this, or the virus subsides, we're going to continue having these headaches.
Bill, I'm sure you'd like to see that where everybody's on the same page. There has been some interesting news, though, and I want to get your thoughts on this. Pfizer and Moderna both saying that they're coming up with a vaccine targeted at Omicron. I think Pfizer saying theirs could be available in March, but it seems to me, and I want to get your thoughts on this, that this seems like, we're fighting the last war. We got to do something about Delta, and then all of a sudden Omicron comes on. I mean, are we going to combat Omicron, but there's another variant that we are not paying attention to that's coming up, that's going to hit us relatively soon? I mean, that seems to be the whole case here, right?
Well, this has been a big surprise for most people, that the virus keeps coming back. In fact, this is the nature of coronaviruses. They kept coming back regardless of previous infections. That's what they do. That's their evolutionary job. Their job as a virus is to infect you when you've already been infected. For millions of years, that's how they've perfected their skills. And I spent a good deal of time understanding how that happens. And they can get better and better at it, as you have seen through alpha, beta, gamma, and delta. There will be new variants. Vaccines will not protect you from infection, but that doesn't mean they won't protect you from disease. I want to make sure everybody understands something about the polio vaccine. The famous Salk vaccine that eradicated polio in my lifetime and in yours, that doesn't protect you from getting infected. It doesn't protect you from transmitting it to someone. It does protect you from becoming paralyzed. And that's what really mattered. So all these people who are saying vaccines should not be the end-all and be-all because they don't stop infection, don't remember that the polio vaccine didn't stop you getting infected either, but it stopped everybody going to the hospital and me from getting polio in the fact that I didn't get paralyzed, or many people don't have it anymore. Thank goodness for that. So it's really important to get these vaccines. Now, this is kind of a cross between polio and the flu. every year it's going to come back in a different form, and maybe twice or even 3 times a year, as we've seen in the past. Maybe it will settle down, but we don't really know that yet. Cold viruses have never settled down, so why should this settle down? So yes, we should have new vaccines. We should try to make vaccines that are broader, but I don't think the vaccines will ever stop this. The only way really to stop this is through behavior change. That can do it. And that's very straightforward. We wrote at Harvard School of Public Health, we wrote the manual on how to do that. Identification, contact tracing, find those people who are exposed and isolate them whether they're infected or not, and then make it economically feasible. Before we end, I want to pick up on something else. You've heard people on the front line talk about exhaustion, but they've also talked about something else called moral trauma. Moral trauma. You heard the healthcare workers say that several times. That's a very important concept, because what moral trauma is comes from the military. When you know your leaders have thrown you into a battle they never should have done. They send you against an enemy when you're unprepared. They haven't done what they should do to protect you, the soldier. Now we're seeing that very same phenomenon with our healthcare workers. We're not giving them the support we need, and you're hearing them use a word you've never heard before in general public, which is moral trauma. And you heard it 3 or 4 times tonight. And I think we have to reach out and understand what our healthcare workers are going through.
Calvin, we're going to give you the last word. We've got about a minute left. He says the generals have sent you off into battle unprepared, and you're up against a tough adversary. Any words of the folks who are here in Washington, D.C. that you'd like to convey before we close things out?
Get vaccinated, get boosted, and stay away from my emergency rooms, especially if you're just looking for a test, unless you want to catch COVID and Omicron. Do a collective action. Do your job. Thank you.
And for you, it's obviously still a passion for you, even with all these hits. What keeps you going?
Love, I guess. I mean, love is a temporary form of insanity. Even you go in, even if you're mortally injured. Thank you to Bill to highlight that, but it's true. You in the military, my colleagues there who did that, they do it for each other. The people they fight, whatever the cause is, they still go in because of one another, and that's why I go in. I fill in the empty holes if I can. I wish I could be multiple places at once, but then I also have to take care of myself. We're juggling a million things, and out of that love, to do something that defies all logical reasoning and do it anyway. Temporary form of insanity. I think that's that is the reason. I can't explain it otherwise.
Well, we're going to leave it there. Thank you all to our guests. Show them some love. Go get vaccinated. That's it for this edition of The Heat. I'm Mike Walter in Washington, D.C. Thanks so much for watching.